Hello, everyone. Welcome. We're so delighted to have you here today. As you are joining, you will notice that you can select which language you would prefer to listen to the webinar in today by clicking the globe button at the bottom of your screen. We have interpretation available in English, French, and Portuguese. So as you're joining, you are welcome to select your preferred language, and we'll get started in just a minute here. Hello, everyone. For those of you just joining, you're welcome to select your preferred language using the interpretation button found at the bottom of your Zoom screen. We're delighted you're joining us today. My name is Cecilia Sorensen. I am the director of the Global Consortium on Climate and Health Education, and it's such a pleasure to see so many people joining from across the region and across the world. As we get started today, we welcome you to select whichever language you would prefer to listen to this webinar in. And it's my honor to pass it over to Dr. Margaret Kaseje to provide welcoming remarks.
Thank you, Cecilia. I extend a warm welcome to the inaugural Africa Climate and Health Responder course. This is a pioneering online initiative that unites professionals from 18 countries across Africa. So your diverse backgrounds in government, in non-governmental organizations, academia, research, and private sector, this collective strength and expertise will drive meaningful change in the face of climate challenges in our continent. This course marks a pivotal moment in our shared commitment to enhance the knowledge, confidence, and our advocacy for climate and health issues. As president of the Association of Schools of Public Health, in short, ASPHA, I'm honored to collaborate with the Global Consortium on Climate and Health Education in co-developing this vital course. ASPHA's network spans 54 countries in Africa, supporting schools of public health to address critical public health issues including climate change. So together we have embarked on this journey to empower you to lead the change in tackling the complex challenges at the intersection of climate change and public health. So I urge you fully to engage with our online experience, to share your expertise, to collaborate with your peers from across the continent. Let us harness the power of this virtual platform to drive innovation, to advocate for change, and to lay the foundation for a healthier, more sustainable Africa. So thank you for your commitment by the way that you have enrolled in this course. So together, let's embark on this journey with a shared commitment and lasting impact on climate and health resilience in Africa. Welcome to the course.
Thank you so much, Dr. Kaseje. It is such an honor to be working with you and your organization and so many other great partners here today. My name is Cecilia Sorensen. As I mentioned, I'm based at the Mailman School of Public Health, and the Global Consortium on Climate Health Education is just so delighted to be working with wonderful partners in the region to put on this course, which will be lasting the next 2 months. The Global Consortium on Climate and Health Education was founded in 2017 based around this global need to build the capacity of health professionals everywhere to be able to tackle the climate and health impacts that we are seeing within our communities. We know that it takes many different types of health professionals to be able to create change, including doctors, nurses, environmental health professionals, public health professionals, pharmacists, veterinarians, and so many others in order to really recognize and respond to the health impacts of climate change, which we are seeing in our communities. So this course is based on our experience running many similar courses throughout the globe, and we have worked diligently to bring to you the foremost experts on climate and health from the Africa region, from an incredibly talented group of partners throughout our networks. We hope you learn a ton during this course, and we hope that this will be just the start of many great relationships in order to build capacity within the region. And with that, I'd like to turn it over to Dr. Wande Alimi from CDC to provide a welcome.
Thank you very much, and good afternoon from different parts of the African continent. Thank you so much for joining today's course. It's an inaugural course, and Africa CDC is pleased to be a partner and to bring this kind of capacity building to our member states. Ladies and gentlemen, allow me to really reiterate the importance of why such efforts and initiatives are very crucial to the African continent. Africa is not a stranger to the realities of climate change. Despite being the least contributor to the CO2 emissions, we are bearing the highest burden. There's a nexus between climate change and health. And this particular course that we are running together with our partners aims to target strengthening the capacity of healthcare workers, frontline workers, rapid responders, and most importantly, bringing the right capacity and information to the communities. Ladies and gentlemen, it's important that as we start to explore the climate change and health nexus, as we try to sort of work together with our member states to ensure that we have climate resilient systems through a multi-sectorial One Health approach, it's important for us to navigate these issues and challenges using the One Health approach, which really recognizes the interconnectedness of humans, animal, environmental health to ensure that we have a robust framework for addressing the shared threats. It's important that we recognize that health systems do not exist in silos. And it's important for us to work together to ensure that we're able to raise the issue of climate change and health to the highest level of policy making and political decision making. So Africa CDC, I bring you warm greetings from our leadership. We're quite excited to see how this course rolls out. We are definitely keen to see more of our member states enroll in this and continue to participate in this. So on that note, I'd like to welcome you to this inaugural course and definitely looking forward to your feedback. We have great tons of experts from the African continent who will drive this agenda. Thank you, and back to you.
Thank you so much. And now I'd like to turn it over to Vincent Pagiwa from the Chance Network to provide a welcome.
Thank you, Cecilia, and I hope I'm audible. Let me also take this opportunity to welcome you all across Africa and the world. And also thank you for showing interest in this wonderful course. And I'm here representing the Chance Network, which is the Climate Health Africa Network for Collaboration and Engagement, which is abbreviated as Chance. This is one of the platforms that we initiated, actually based on what my other colleagues have already said about the impact that climate change has on our health in the African region. And this is one of the mechanisms that we came up as a strategy to mitigate such impacts on human health. So the Chance Network is an African-based network that aims to develop synergies in African climate and health response and advance policymaking across the region, facilitate evidence-based knowledge exchange, learning and cooperation, as well as also to provide technical support for national and regional application for funding for climate change and health programming and research. So we have really contributed to a number of policy development and strengthening on climate and health nexus in Africa, especially we contributed to the South African Heat Health Action Guideline, which is really a good success, and also many other initiatives in the region. We also have contributed to a high-level dialogues on climate change and health, including the COP27, COP28, as well as other local African regional platforms that the Chance Network was instrumental. And also we happen to be partners and contributors to this climate change and health responder course, for health professionals. And on behalf of the Chance Network Steering Committee, let me again welcome you all to this course, and I hope that you find it useful and relevant to your specific local needs. Thank you so much and all the best.
Thank you so much, Dr. Pagiwa. And I will now turn over to Dr. Anyango from WHO. Over to you.
Hi, Cecilia, and thank you very much for this opportunity for AFRO to participate in the inauguration of a very important course for our public health practitioners. Esteemed colleagues, participants, greetings from Brazzaville, Congo. This is where the WHO Regional Office for Africa is located. My colleagues shared with me the summary of participants that are registered for this course. And I was really impressed to see that only about 1/3 are currently students. That 68% of these many professionals, therefore, have not received prior training in climate and health, meaning that there's a need for us to take action in an area that is definitely key to what we need to achieve in public health. And yet, we need to integrate new knowledge, what is happening right now that needs very rapid responses, and therefore the name of the course itself is absolutely appropriate. It means indeed that coming from all these many different backgrounds, geographical as well as professional, we all recognize the critical challenge that is climate change, and from our varied backgrounds, in fact, across the planet, from what I could see of the names of the people registered, we are ready to form a united force to address that challenge. Climate change is a health and well-being issue. It affects every aspect of our lives, from the water we drink to the air we breathe, the security of our food supplies, and the integrity of the homes that give us shelter. So tackling climate change is not only about saving our environment, it is really about saving our lives. In Africa, where our rich soils bear bountiful harvests and our rivers sustain vast communities, the landscape of health is being reshaped. Despite contributing minimally to the problem, as has been mentioned by previous speakers, our continent is disproportionately burdened by its impacts. This reality is not just a call to action, it's actually a call to arms. And I'm very glad to see the number of people that are ready to take up arms and to respond. The Africa Climate and Health Responder course, developed in collaboration with key partners, should not just be a series of lectures. Let it be our collective stride towards empowerment. Let it be about turning information into action, knowledge into movement. This initiative represents a critical opportunity, the chance to lead in the face of adversity, to innovate in the shadow of tradition, and protect our future against the tide of uncertainty. Our communities face extreme weather events that are increasing in their frequency and the scale of devastation that they leave behind. Floods contaminate freshwater supplies, turning them into vectors for cholera and other diseases. So the resilience of our communities and health systems is overstretched. Each of you has answered the call to learn, to lead, and to serve. The climate challenge is huge, and this course is a tremendous opportunity. The skills you will refine here and the tools with which we will forge a healthier, more resilient Africa is right here within reach. The knowledge you gain will echo in the policies you advocate, in the communities you strengthen, and ultimately in the lives that you save. Thank you very much for stepping forward, for being part of this crucial journey. Let's embrace this challenge with the resolve and determination that it demands. And I will leave you with a few words from J.F. Kennedy in his 1963 peace speech. Our most basic common link is that we all inhabit this small planet. We all breathe the same air. We all cherish our children's future, and we are all mortal. For our own sakes, let's remember that. Welcome to the Africa Climate and Health Responders course. Cecilia.
Thank you so much. Thank you to all our partners. And most of all, thanks to all of you for being here, for making this a priority. We know you're very busy, and we are just delighted and honored that you are joining us here today. So with that, we have a few course logistics to go over with you, and then we will jump into our first learning session today. So with that, I'll turn it back over to Dr. Margaret Kaseje. Thank you.
Thank you, Cecilia. So once again, welcome to the course. Just a few logistics. There's going to be simultaneous translation, and it's available in English, French, and Portuguese. So all you have to do is click at the bottom of your bar where it says interpretation. Next slide. So we are really happy and excited to see how we have come together as partners, as you can see on the screen. We are a number of partners, about 8 of us, who have been working together over the last few months to just make this course possible for you. And we want to especially thank WHO, Africa Region, and Africa CDC, as well as all the other partners. So the course objectives are going to cover 2 main areas. One is to enhance you as the professionals, enhance your knowledge and skills to help you address the climate crisis, to advocate effectively, and to improve population care. And then secondly, the objective is to build a supportive community, as has been mentioned before, for climate health education, for advocacy, and for research, so that we can engage as African health researchers in climate and health research, and also to look at possibilities of funding opportunities. Next one. So the sessions we're going to have are 11 in total. Today is our first session on climate change for the health professional. And over the next few weeks, we'll be having sessions up to the 10th session, which will happen in October. And so we hope that you will not get tired, but you will walk through these sessions twice a week and end well. Next slide. So this is exciting. You're going to get a certificate for attendance, but you need to attend 8 or more of the live Zoom sessions, and you need to pass exams at least 70% or more at the end of the course. Then you'll be awarded a certificate of participation in climate and health from the GCCHE. Now, the certificate of participation is only available to people who use the same email. Please use the same email for registration, for all your Zoom sessions, and for the exam to help us track your attendance. Next. So attendance is automatically recorded. Your individual attendance is only counted if you join, as I said before, using your personal Zoom link. It will not be counted if you use a link belonging to your colleague. And YouTube views will also not count towards attendance. Next. There's going to be a final exam, like all other courses. So the format will be very easy, 25 multiple choice and true false questions. The exam link will be sent on the final day of class through email and WhatsApp, and will remain open for 48 hours. So be prepared to take the exam at one sitting. Next. Next one, yes. So the sessions are 90 minutes in total. It will end with a question and answer section, like we do that today. Enter your questions in the Q&A section. There's going to be recordings, video recordings, slide decks, and resources which will be made available on the course website. Next. So our learning objective for today's course, session 1, is on climate change for the health professional. So again, there are 2 major areas that are going to be covered. The session is intended to enhance the knowledge of health professionals like yourself, to improve population care, and of course, to serve as advocates on climate health. And secondly, the session is going to help you have some skills and to know how to incorporate climate change for education, for advocacy, and for your policy support. So all these will be available at the end of the session. Next. So now we are getting into it. Let me introduce to you our first presenter for this course. She is Dr. Caradee Wright. Dr. Wright is a Chief Specialist Scientist at the South African Medical Research Council, leading the Climate and Health Research Program. She's also an adjunct professor at the University of Pretoria and the University of Johannesburg. Her research is in environmental health epidemiology to understand climate change and air pollution impacts on human health and well-being, to inform adaptation, interventions, and policy development in Africa. Dr. Wright has published more than 180 research articles in peer-reviewed accredited journals. She's a committee member of WHO Air Quality Guidelines Committee. She's currently the technical advisor to WHO, the International Livestock Research Institute, the Health Effects Institute, and a review lead for the National Institute of Health. Welcome, Dr. Wright.
Thank you very much, and greetings to everybody far and wide across the African continent. It's a real honor to be with you today, and I hope that we will be able to learn some things together. I'm going to share my screen so that I can share my slides. If somebody could perhaps confirm that they can see them when I have loaded them into the correct full screen mode, that would be great. Then I'll carry on.
It's loaded.
Thank you very much. So welcome to the very first session of the learning series for the Africa Climate and Health Responder course. And I've got the great honor of introducing you to climate change. Knowing that many of you are health professionals, I'm going to start at the very beginning of the story and build our way through in terms of the content. So an overall outline of the learning session today, very briefly, and this is what we're going to cover in the next few minutes, is what is the greenhouse effect and how do human activities affect it? What is global warming? What are the drivers of climate change in Africa? And what are the health impacts of climate change in Africa? What does vulnerability mean? What is the difference between mitigation and adaptation? What does resilience mean in the context of climate change? And finally, what is the role of the healthcare sector and the health professional? So to start off, if we have a look at what the greenhouse effect is, it's very much like a greenhouse in which you would plant some vegetables and look after them with water and all the right fertilizers to make plants grow. In the same way as a greenhouse, the earth has a special layer around it that helps keep the temperatures on earth just right for human existence. So solar radiation powers our entire system. If it wasn't for the sun, the earth would not exist in the way that it does today. So some solar radiation comes down to earth and is reflected back from earth into the atmosphere. About half of the solar radiation is actually absorbed by the earth's surface and the earth's oceans. And of course, that's important because we know things like sea surface temperature really help contribute to the balance of ecosystems on the planet. Then we have some infrared radiation. Now, infrared radiation is actually the stuff that we feel on our skin. When our skin feels hot, that is infrared radiation. So this passes through the atmosphere and is absorbed and re-emitted in all directions by what we call greenhouse gas molecules and clouds. So these little particles in the atmosphere keep some of that warmth, that stuff that we can feel, the infrared, tightly to the Earth's surface. And this effect then is to make sure that the Earth's temperatures are habitable for us. If we didn't have this greenhouse effect and this atmosphere around our Earth, we wouldn't be here. We would be frozen solid because we are too far away from the sun to be able to exist in a way that the Earth would maintain temperatures for habitable life. So essentially, Greenhouse effect describes the atmosphere, which is a blanket around the Earth to ensure that the Earth's temperatures are just right for human existence. So what is the problem? Why are we worried about the greenhouse effect? This effect has been in place since the beginning of time and has always functioned with natural fluctuations, but something has changed. And this is mostly due to human activities. And so this will raise things, for example, around climate change denialism. And so this can be highly contentious. And so we have to navigate these waters carefully to ensure that we provide the evidence to substantiate what we're saying, that the greenhouse effect always been there, but something is up. Something is different to what it was before. So on the left-hand side, we can see the things that are not supposed to be in the atmosphere in the quantities that we are now seeing them in the atmosphere. Remember that blanket around Earth. Things like carbon dioxide, methane, nitrous oxide. They are meant to be there, but in much smaller quantities than what they are today. Similar to hydrofluorocarbons, so those are the HFCs, sulfur hexafluoride, and others. So some of these things, which I'm sure you can relate to, is CFCs, right? So things where we've noticed in our aerosol spray cans, it now says no CFCs. So they've removed those chemicals that were going into the atmosphere that were changing the particles and keeping more of the infrared or heat in closer to Earth. So we've stopped CFCs, but unfortunately, we haven't stopped all of these gases that are going into the atmosphere. And where do these gases come from? They come from things like burning coal, oil, and gas for energy, the fertilizers that contain nitrogen that we use extensively in agricultural regions, cutting down forests. So in this case, it's a very strong relationship between there being too much carbon dioxide in the atmosphere and global warming. If we remember that as humans, we breathe in oxygen and we release carbon dioxide in our respiratory function, many of you will know, and our forests take in the carbon dioxide and return back oxygen. If we don't have sufficient vegetation, forests and plants doing that process, we don't have a control over the carbon dioxide levels that we are emitting. Increasing our livestock farming does lead to increased methane levels, and then a bunch of the other things that I spoke about, the fluorinated gases, for example, in aerosol sprays, as well as refrigerators and air conditioners. So essentially what we're seeing is a warmer world. So looking at NASA's statistics, the global temperatures in 2021 were almost 1 degree Celsius above the average for NASA's baseline period, according to the scientists at NASA's Goddard Institute for Space Studies. So NASA uses a baseline period of 1951 to 1980. So in other words, global average temperatures are almost 1 degree warmer than between the period 1951 and 1980. Now, that doesn't seem like a lot. You know, if it's 27 versus 28 or 16 versus 17, does it really make a difference? Well, the challenge is that's the global average. So in other words, every place around the world that's measuring temperatures is feeding information into this database. So some places may be experiencing the difference between 44 and 45, or 39 and 40. And so they're starting to see temperatures in a different degree Celsius block of tens that they've never experienced before. And that's where the challenge lies. The global average is around 1, but some places might be seeing much more, like a 2 or a 3 compared to what they'd experienced before. If we look then at the warmest years on record over time, we can see that there's been a general trend of warming in the last 40 years. So to explain this graph, the blue and the red above and below the zero line is saying it's an anomaly. So typically in the past, 1800s, temperatures were cooler than usual. something changed around about the industrialization period on Earth. So from 1940, there were little glimpses of the global average temperature of the Earth being warmer. So then we saw warmer with the orange, cooler with the blue. And since around about 1980, we have started to see temperatures on Earth that are typically higher than we have seen in the past. And it does, as I say, link to the Industrial Revolution and weather stations being set up to help us track and understand these changes. Then if we hone in on Africa, our own continent, I would like to speak a little bit about what climate drivers are. So the climate is an amalgamation of everything that equals weather. So rain and cloud, wind and temperature, snow, hail, and sleet. We don't necessarily see so much of that in our continent, but we do see it occasionally. All of these things are called climate drivers. And what's happening in a changing climate is that we are starting to see these climate drivers changing. So the Intergovernmental Panel on Climate Change, or the IPCC, draws together hundreds of scientists every few years, around about 5 years, to put together the best evidence that we can with the most confidence that we have in that evidence to explain or express what we think is happening on the African continent. And for the very first time in the IPCC Assessment Report 6, Chapter 9, we have some amazing diagrams like this to help us summarize what is going on the African continent. So I'm going to take an example of where I live in East Southern Africa, which is where the blue line is pointing. But of course, you can look at your region in Africa. And of course, you can also go and access the report online from the IPCC website. So in East Southern Africa, if we look across that row, and I'm going to focus on those first 4 squares. So the climate driver here is temperature, and the difference is around heat and cold. So for the first block, it's the mean air temperature, and it says that it's red. So the red tells us that based on our evidence that we have from all the science and research going on for Africa, we have high confidence that the temperatures in this region of the world have increased and are increasing. The black circle tells us that these changes have already emerged in the historical period based on observed data. So we have got enough evidence to support that we have seen increases in temperature in the East Southern African region. And then the next block is extreme heat. So this is usually heat waves and occurrence of hot days, and it's exactly the same. Then for the cold spells, we've got blue. So the blue tells us we've got high confidence of a decrease in the number of cold days or cold spells. And the black dot says the same, that we've already seen this in our observed historical data. We don't have a circle here because we don't have enough information to be able to say with confidence, is this decrease statistically significant or not? And if we go just one more, I'm going to sneak into the next one, which is the mean precipitation, just to give you an understanding of how difficult it is to understand the rainfall changes that we are seeing across Africa. So the light blue color tells us that we have medium confidence of a decrease in mean precipitation. So we are starting to see reductions in rainfall and increases, I suppose you could say, in droughts. And the purple tells us that this is emerging by 2050, and it's based on a specific scenario. So the challenge with rainfall compared to temperature is rainfall is far more unpredictable. It depends on cloud cover, and that changes radically in a day. So we don't have as much confidence around the changes in rainfall in the future across this particular region in Africa and similar to others. So then if we would like to summarize the climate change related health impacts across the African continent, and this is by no means a non-exhaustive list of what those would be. Oh, sorry, I went one step ahead there. There are some really challenging climate drivers leading to health outcomes that we are going to be seeing and are already seeing in the future. I'll highlight one or two that I think are pretty serious. First off, since we've just spoken about heat, the heat-related impacts. So here we can see a range of examples: heat stress, exhaustion, and heat stroke, increased mortality for those suffering with pre-existing conditions, dehydration, heat exhaustion and stress can lead to damage to brain, kidneys, and liver. We have a number of examples of these. For example, I know in the Sahel there was a heat wave very recently and there were 102 deaths. In South Africa in January 2023, 7 farm workers passed away working on a grape farm. So we're starting to see more and more recognition as well. The challenge here is that we don't always apply the ICD-10 code, which is a Z code for weather-related mortality when there may be, for example, other comorbidities. The others that I'd like to highlight are things like drought impacts, infectious diseases, and flood-related injuries or drowning. But over and above that, there's some things that we may not yet be thinking about in Africa. Mental health. The health, environmental, and economic consequences of climate change contribute towards feelings of sadness, fear, despair, anxiety, and grief. If you lose your home, and your home is all you have with no household insurance, what are you left to do? This is a very real challenge for millions of people who are going to unfortunately face these scenarios. And at the end of the day, we are trying to think about how can we support these communities best. Other things like sleep disorders, substance abuse, aggression, and mental disorders. And so when you are seeing patients who are presenting with these outcomes and health challenges, it could very well be that they've gone through a climate shock or an extreme weather event. And we are going to have to start to be much more cognizant of what this means in how we treat patients. So then I'd like to turn to what is vulnerability. So this is some definitions, and these are important for us to understand. So the high-level definition of vulnerability is the propensity or predisposition to be adversely affected. And in the context of climate change, it is really as a result of a complex set of drivers and interacting conditions of a system that derive from both the historical as well as the prevailing cultural, social, environmental, political, and economic contexts. So the most obvious way of understanding vulnerability is across a spectrum. There are some people who are able to cope with the shocks that life deals with them, and there are others who cannot, based not only on the intrinsic vulnerable factors, but also those that stem from historical, cultural, social, and environmental or political and economic contexts. So if we think about this in the context of climate change again, certain populations will bear, unfortunately, a disproportionate burden of the health impacts associated with climate change in Africa. And the extent to which these individuals or societies and even nations will experience the health impacts depends on their ability to be able to adapt to stresses in the event that there has not been sufficient mitigation to protect nations or communities at a higher level. To start off with, we have to consider inequality. So in the instance of a low or middle or high income community, we would expect that the low income community is facing the greatest inequalities and injustices compared to the others. And they are facing not only climate change challenges, but many other, particularly lack of appropriate housing or unemployment, for example. Then we have to think about disparities. And the classic one in our case here, since we're talking about health with each other, is access to health care. And the disparity in access to health care for somebody in a low income community who would probably use the public healthcare system versus someone in a high income community using a private system. Not only that, but we know that certain diseases are more prevalent among low-income communities, given the social determinants of health that they face. And finally, environmental injustices. This is where, for example, and a classic example is in South Africa, where our apartheid planning meant that low-income communities were placed in positions of environmental risk alongside polluting refineries or alongside floodplains and waters that would burst their banks. And these kinds of things all increase the vulnerability of our communities. So if we think about the determinants of vulnerability, and I won't go into this, you can look it up after, there are three components that we need to think about. The first is the exposure. What are people being exposed to that puts them at risk? The second is the sensitivity. And I've mentioned the examples of why certain people would be more sensitive to the adverse impacts of climate change. And the third is the adaptive capacity. It's not possible for a person living potentially, anyway, as a hypothetical scenario, to pull out a document of insurance when their house has been impacted by flooding and say, here's my insurance. No, I've insured my shack and now I'm going to claim that back. Insurance is not available for people living in shacks, in which case they don't have the adaptive capacity to build back or restore their home or dwelling for them to be able to continue with life. And this is the challenge that we face in terms of vulnerability. And all of these, of course, lead to the health impacts that I mentioned before, from injury, acute, and chronic illness, including mental health impacts. So here we have a snapshot of those people that we know to be vulnerable in the face of climate change. Neonates, infants, and children, especially vulnerable, people who are elderly, and people with physical disabilities, as well as mental disabilities. All of these people are in positions where they cannot always necessarily care for themselves. They rely on others. And that's one of the main reasons that they are vulnerable. Outdoor workers in the context of heat, I've already mentioned that, pregnant mothers and mums with small babies, and then those people who have pre-existing diseases. These people are all highly vulnerable, and we need to pay particular attention to them when caring for them, particularly in cases where we've seen climate changes in the form of extreme weather events. This is just a small illustration, and I'll just take children as an example. Children cannot be treated as little adults. They are not. They are different from adults. Their bodies are physiologically different. They breathe more air, drink more water per body weight compared to adults. They're still developing their organs, and they have low immunity. They are dependent on adults, and they do often spend more time outside. So the kinds of effects that we're worried about from the climate are air pollution, extreme heat, flooding and water contamination, food insecurity, droughts. And these are the health impacts, just by example, asthma and allergies, and malnutrition, which is a known real challenge across the African continent. So then we'll turn to the next bit, which is around mitigation and adaptation. So a way of understanding the difference between these two is that mitigation is trying to solve the problems about the greenhouse effect that we learned about earlier. So for example, we want to stop using oil, coal, and gas to make our electricity, and you want to turn to renewable energy sources. And that way we can reduce all those nasty gases going up into the atmosphere. If we look at what adaptation means that the climate is going to probably continue changing, even if we make those mitigation things, because there's going to be a delay in the recovery of Earth. What can we do? We need to think about more resilient agricultural species. What plants are going to grow in our typical rain-fed agricultural areas in Africa? Can we surveil things? Can we do malaria surveillance and maybe start spraying early to ensure that we don't see an increase in malaria? And then can we increase green spaces? Can we raise awareness? Can we try and save water? These are things that help build the adaptive capacity in terms of adaptation. Resilience is something a little different. So in this case, we're trying to think about how can we anticipate, prepare, In other words, tabletop war scenarios where we're thinking about what can we do to prepare for the impending extreme weather event? What can we put in place so that we can make sure that we respond appropriately to hazardous events, trends, or disturbances? What can we do to improve climate resilience really involves assessing the current climate change scenarios and what it means that's going to be in the future. What are the risks going to be, and how can we take steps to better prevent any health impacts from those risks occurring? So there's a sweet spot sitting between vulnerability and resilience where we have adaptive capacity, coping capacity, diversity, collaboration between institutions, pooling of resources, and productivity to make sure that we can get this all off the ground to transform our societies into places that can cope with the impending climate threats facing us. And then I'd like to turn to climate change in the healthcare sector. These are 3 spaces where you can go and have a look at more information, particularly in the primary healthcare space. So Healthcare Without Harm is doing incredible work, making sure that facilities and healthcare practices are thinking in ways that are what we call greener or more environmentally friendly. Global Green and Healthy Hospitals is another one. And then the Healthcare Climate Council has a really fun website. So that screenshot is actually an interactive website that you can go and have a look at. Click on those different things to say, what is food like in my facility? And it will actually shoot up and show you where food is in the organization or the facility and what can be done to try and ensure that the carbon footprint of the facility is as small as possible. I'm going to talk about that in a moment. So I'm going to share 2 examples that talk through this decarbonization of the carbon footprints of healthcare facilities. The first one is in Valdivia, which is in Chile, the south of Chile, and they've been working really hard to reduce the carbon footprint of healthcare facilities in that region. So they first of all joined the Global Green and Healthy Hospitals Network. And then as a first step in this trajectory towards a green course, they hired environmental managers for each of their facilities, which sounds bizarre because environmental managers are usually in organizations that have what are seen as direct impacts on the environment, for example, coal-fired power stations or some kind of smelting industry. But in this case, they thought it was important to have these people in hospitals and clinics to become their environmental leadership committee. They then looked at the government's environmental management plan and trained all of their staff in understanding what this plan meant and what they could do in each of their facilities to reduce the impact on their carbon footprints. They used the Healthcare Without Harm's carbon footprint tool. And what was really interesting, and I'm going to read it, is what the coordinator of this environmental management leadership committee said. The Valdivia Healthcare Service was once a source of pollution in the region. When we first joined the Healthy Hospitals Network, we understood it as an opportunity to take responsibility for our environmental impact. But we also realized the great potential we had to drive change in our region. And so following this, not only have they seen a change in the hospitals and healthcare facilities acting on their emissions through these 7 high impact actions, but other industries and other sectors, including the transport sector, have done the same. The second example is in the United Kingdom. This is through incredible partner engagement. In 2020, the National Health Service launched its campaign for a greener NHS and commissioned an expert panel from around the world to set out practical evidence-based and a quantified path to their net zero, which means trying to make as little carbon emissions. Remember, those are the bad things that make the warmer earth and that greenhouse gas effect. The work comprised of consultation with patients and staff, and they set 2 targets for themselves: net zero by 2040 for the emissions that the National Health Service controls, and I'll mention this in a minute, and net zero by 2045 for the emissions that the NHS has the ability to control. And they had one of the successes, first in the world, for a net zero delivery and surgery and the very first zero emission ambulance. And what does it mean by those things that you can control versus not? Well, the hospital controls where, for example, its waste goes and how its waste is processed. But a carbon footprint is more than that. It also includes how every staff member and every patient gets to the hospital. And if every staff member or patient, or some of them anyway, are driving diesel vehicles to the facility, those emissions from the diesel vehicles are included in the carbon footprint of the hospital. So what they're saying is they've got to then try and advocate and raise awareness about taking cleaner transport options to get to the hospitals. In a very interesting study of health professionals, perceptions were assessed around almost 5,000 people around their views of climate change as a human health issue. Several personal, professional, and societal barriers really do impede them from taking action in terms of climate change and health advocacy. And that's what we're really trying to help with you, for you today, to have more information, to be able to advocate on different levels for change, to prevent adverse harms from climate change health impacts. Time constraints were really the most widely reported barrier. We know that health professionals have lots of paperwork, long hours, and other challenges, including their own personal lives to manage, and trying to think of the best ways that we can support health professionals to do this and really add to this momentum that we need to support prevention of adverse health effects from climate change is a challenging one, and we respect people for trying to take the effort to do so. The requested pleas for help from health professionals like you were continuing professional education, something that we're doing right now, communication of training, patient education materials, especially those in their own languages, action alerts, and guidance on how to make healthcare workplaces sustainable can all help to address these barriers. I'd like to raise just a moment, I'm almost done, raise some information about a World Health Organization's toolkit for health professionals. It's called Communicating on Climate Change and Health. It's really a comprehensive pack of resources to help professionals understand the health impacts of climate change. But not only that, also the co-benefits of climate action. So what co-benefits mean is, in many instances, if we make a change that will have a positive impact on the climate, it will likely have a positive impact on something else. The two classic examples are, if you can sort out medical waste in an appropriate way, you'll reduce air pollution emissions. If you can encourage people to not drive their diesel vehicles to a public healthcare facility, but to take public transport, or if they're well enough and they're going for a checkup to ride a bicycle, they can reduce their carbon emissions. And we're trying to build confidence in the communication and engage with stakeholders effectively using this toolkit. And of course, health professionals are well placed to play this unique role in their communities, not only in the rooms where they're doing the basic work that we really need, or the hospital rooms, but in their communities to advocate for a better understanding of climate change, both protecting themselves and their communities, as well as the understanding the health benefits of climate solutions. So a couple of slides, just two. Health Professionals for a Healthy Climate. This is a really interesting website. It's called Healthy Climate Prescription. It gives you a bunch of things from building healthy green hospitals, as well as how to participate in climate collective action and being prepared for what we're expecting to see, an increased need for services in the healthcare sector due to climate change. And 3 points that we should really emphasize. We'd like our health professionals who really do have a very solid voice in terms of our government to advocate for reduction in emissions, especially those from coal-fired power stations and other very large sources that are emitting those harmful pollutants into our atmosphere. If we could think about ways to advise our patients around low carbon diets, as well as active transport, and possibly even emulating these themselves to be the champions and the leaders, and then to lastly cut workplace emissions where as far as possible. Thank you very much for listening.
Thank you very much, Dr. Wright. We really appreciate a very, very informative session and very, very clear. And it will help us begin to align our thinking and hopefully our actions to issues of climate and health in the continent. Thank you very much. Now we'll be going into a session of questions. So if you have any questions, please go to the Q&A and we will see how we can pick your questions for responses. So there are some questions. I'll pick the first 5. So Dr. Wright, there is one person, Ula Mothibi. She wants to know the specific drivers of the climate change that we are seeing in Africa. I'll just mention them all and you can pick. The second one is from Peter. We all know, he's saying that we all know what is causing climate change. Why can we not stop what the causes are? What can be done? There's another one referencing global warming over time slide. Are these 1951 to 1980 based on one's location? The question is, what is the range? There's another question. What tools are used to record data for temperature in Africa? The observed data mentioned, for instance, on climate drivers on that slide. And then lastly, when the temperature was below average in the 1800s, were there adverse effects experienced as are being experienced now that the temperatures are higher? So Dr. Wright, just a few of those questions, if you may respond.
Thank you very much, Margaret. That was a barrage, so I might not necessarily remember all of those, but I will try, I suppose. So
yes, go ahead. Yep. Go ahead.
Okay,
yes.
I'll try. I've made one-liners, so I might need help to be remembering what were the specifics. So the main climate drivers that we recognize according to the IPCC are the changes in ambient temperature because of changes in gases in the atmosphere, the changes in sea surface temperature because of the changes in the gases in the atmosphere changing the warming around the Earth. So sea surface temperatures affect all sorts of things from El Nino, La Nina to the surfaces of the Earth, right? And also the rainfall. So if you cast your mind back, if you did geography at school way back when, you will know that there's big cells, there's 3 big cells that go between the equator and the tropics, and then from the tropics a little bit further to the mid-latitudes and then down to the poles. And if those things are not balanced, then the way that the entire Earth functions is not in balance. So in terms of climate drivers, I would definitely say that the temperature change is a major one, sea surface temperature is another one, and all of these are unfortunately related to anthropogenic activities or man or human activities happening on Earth. So there's a lot of controversy around whether or not this is a natural procedure. You know, we've seen, if you remember the movie Ice Age, we've seen ice ages in the past. We can look through these big ice cores that show us periods of warming and cooling. The problem is that these climate drivers now in our century are happening they're pushing change at a much faster rate than we would have seen in the past. Why can't we stop these changes? So that's a really interesting question. And I only wrote that, so I can't remember the rest of the context of it, but why we can't stop it is because we have to act together to do so. And if we take Africa and we think of the African Union, the Africa we want, the Agenda 2063, right? We are all about projecting our way to a developed Africa where everybody has the opportunity to quality of life, opportunity to work, and other things that people in places around the world have today. And we are still on that trajectory. So, of course, because we're in different places of development, not all countries are going to sign up and say, yes, I'm all for changing to renewable energy at that enormous cost, when other countries were able to do it 80 years ago without the cost. So there's a real challenge and dilemma and tension at a member state level of, well, what am I allowed to do that you've already done? And why can't you pay for what I want to do to get to where you are, if that makes sense? So even with all the global agreements that we have, we are not necessarily going to be able to get to a space where everyone will put their hand up in the classroom and say, yes, I'm willing to stop completely emitting greenhouse gas emissions to ensure that we stop global warming, and I'm willing to sacrifice the future development of my country. No one's going to do that. Well, very few people or countries or member states are going to do that because they're thinking of the best interests of their people and society. So there's a playoff at hand and a negotiation. So getting the complete stop is impossible, but negotiating pathways towards a space where we can see the world is trying to collaborate to make sure that we can reduce greenhouse gas emissions and reduce global warming is something that's happening. I can't remember the next one. I think it was something to do with a range and temperature, and it was about there being just the global average, which was a mean instead of the range. I agree with you. It would be very helpful to see the range. And I guess there's almost an obsession about just looking at the global mean, which does taint our understanding of what the variation would be across the globe. So I think that would be a great way to express things with a range. In terms of the tools that we are recording temperature around Africa using, so in many of our countries in Africa, we don't have long-standing weather monitoring stations or networks. And so what's been happening, and which for which I think it's a really good thing, is that we've got satellite data. So satellites orbit around the world, around Earth, and many of these have swaths or paths that cross over Africa, the African continent. So for example, there's MODIS, and that is a monitoring station on a satellite that is capturing information around meteorological variables, including temperature, for all places across the African continent. It's not at the highest resolution. It's sometimes at tens of kilometers, but it's better than nothing. So we've got that information. And the second is that there's a real interest and growth in the installation of low-cost sensors around many African countries. And these low-cost sensors are reasonably reliable. They give us data at a very low resolution from people's homes to communities or public spaces. And we're using all of these data to better understand heat or cold risks. And that leads me to the last one, which is the question that was around, well, the temperatures pre-1940 seem to be colder, right? So that's not true. So that plot was showing the anomaly or the difference. So this goes back to an average, right? So there's an average temperature which people can live at comfortably. I don't know what that is. For me personally, I really like warm temperatures, but other people might like 22. Let's go with 22 because that's kind of like the temperature that I think many businesses set their temperatures to, or people can be comfortable at. So if the temperature has been 22 in 1880, that plot was telling us that one year it was 21 or 20 or 18 or 21. So it was just saying that it was constantly lower than 22, but 22 is still very comfortable temperature. Not for me, but many people. But from about 1940, that 22 was constantly warmer, 23 or 25, or up until now, 30, 32. So in other words, the temperature changed. It wasn't necessarily cold or hot, but it was different from what the average was. I hope that makes sense.
Great. I can see another barrage of questions. These are very interesting. One question is, what is Africa contributing to climate change? That's one question. The other one is, can you explain what carbon footprint is? And the third one, what is carbon credit?
Okay. I will do my very best. These are difficult questions, and Google may be your friend if I don't answer you completely. But in terms of Africa's contribution to climate change, there's a long-standing debate that Africa's contribution to climate change is far less than high-income countries around the world. And I'm not going to name countries because that would be unfair. But of course, Africa does still contribute to the emissions that then connect to the global warming and that greenhouse effect that I spoke about. So one of our biggest challenges in Africa is household air pollution from domestic solid fuel burning. So this is a mechanism where people are using coal, wood, dung, biomass, and other things in their homes. Either they don't have electricity or they can't afford electricity, and they are using it for heating or lighting or cooking. And the direct ramification is emissions. So the problem, of course, immediately is it's in the breathing zone. So they risk health impacts. But of course, these emissions also contribute to the outdoor or ambient air quality problems that then contribute towards the global warming problem. So the gases like sulfur dioxide, carbon dioxide that we saw are a challenge, do come from these domestic burning situations. The other challenge, of course, is that we still, and in South Africa, unfortunately, the challenge is coal-fired power stations. So that South Africa's coal-fired power stations are among the highest emitters of sulfur dioxide on the African continent, if not the world. And sulfur dioxide is a greenhouse gas, which is contributing towards global warming. So yeah, Africa does contribute, but not in the same way as other countries have done in the past and still continue to do. And so the learning for us is really how can we do things differently to make sure that we can try and reduce our emissions while not hindering our opportunities to develop and ensure that our people can live the best possible lives. So the difference between a carbon footprint and then a carbon credit. So the carbon credit is very tricky, and I'm not going to profess to understanding the details of it. I'll give a very high level illustration. A carbon footprint, in the case, if we think about somebody like me who has to travel for work, if I think about immediately in my home, if I want to understand the impact that I have in terms of carbon emissions, that's what determines my carbon footprint. So for example, I would think about everything from where do I get my electricity? So some of my electricity comes from a coal-fired power station. That coal-fired power station is emitting sulfur dioxide and carbon dioxide. That's part of my carbon footprint. Where does my food come from? Some of my food is probably made in a factory, and that factory has pollution emitting carbon dioxide, again, part of my carbon footprint. How do I get to and from school, work, and other places? I drive a car. The car has emissions. Those emissions, again, contribute towards my carbon footprint. Of course, this is a simple example. In a healthcare facility or primary healthcare facility, gets far more complicated. From everything from where are these sheets, the cotton from these sheets made, to where does the food come from, where's our waste processed, how are our staff members arriving at work, what are they eating, and so on. It's a real challenge. Carbon credit is a little bit like trying to understand a bubble. So if I had to take my little house scenario, and for example, if I installed solar panels and I was able to save my spend on the coal-fired power station's expense, and I was able to give that carbon credit to somebody else to help them reduce their emissions. It's kind of like a saving on carbon and sharing it with someone else who needs it to be able to bring that down. And the carbon credits are actually nowadays within kind of like a carbon airshed, and they are distributed between to help companies especially be encouraged to reduce their carbon emissions. That's my high level response to that one, but probably best to look it up.
Right, thank you. There's quite a lot of questions coming in. One question which may lead to what you're saying is, could you give us some examples of low carbon diets? And what are the elements in constructing green hospitals?
Okay. So I'll start with the second one first. The green hospitals, that website that I showed with the illustration of how you can select different options to go and see what you could do to implement a green hospital together with the Healthcare Without Harm websites are really good resources to better understand how the elements of a hospital can be changed to increase the greening concept. Very simple ones, though, would be if people are not in a room, turn the lights off. Simple. Keep the lights off in spaces where people are not to try and save on electricity. Another one would be, and again, it's a very simple one, recycle. Please have different bins and separate at source, and ensure that whoever is collecting the waste keeps them separated and processes them accordingly. Two very simple mechanisms, in fact, not only in healthcare spaces, but in any workplace that can be done to try and reduce the carbon footprint of the workplace or the healthcare facility. The others are a little bit more complicated, and I really encourage you to go and have a look at that website with the options for you to be able to interact and get good examples. The low carbon diets is an interesting one because, of course, we are all culturally familiar with the foods that we enjoy, and nobody is essentially saying that you should totally change what you eat or what is culturally appropriate to you. It's just about making small, different steps, potentially not eating highly processed food every day. So you should be able to identify what you eat. You should be able to know what it is. And the second one, of course, is that obviously proteins are critical, and a variety of non-vegetarian diets are acceptable. The challenge, of course, is that we should try and not have those non-vegetarian options every day. So if we can potentially have meat-free days where we rely on alternative sources of protein, if possible, obviously all sorts of allergens also need to be taken into consideration. That's where we should try to head. It's to really think about the footprint of where the product that you're eating is, where does it come from? So try to support locally grown and as much as possible unprocessed foods.
Right, thank you. I think we are beginning to really align to the issue of climate change. Someone is asking for examples of mitigation, examples of adaptation, examples of resilience. You mentioned those three critical words.
Yes. Yeah, so those are our three incredibly important terms in the climate change and health space. And they are difficult to unpack for different audiences or sectors. So I'll try and give an example from one or both if I can. So in terms of mitigation, mitigation is very much at the level of member states or governments. It's much more difficult at an individual level to mitigate. So if we are to reduce carbon emissions in a way that is meaningful to change the actual emissions that are affecting that greenhouse gas effect, we need collaborative efforts at community or country or regional scales. So we have to change the emissions going into the atmosphere. This means things like changing from coal-fired power stations to renewable energy, wind, solar, hydro, right? So even though there is the incredible benefit of somebody installing solar power in their house and mitigating their use of coal or purchasing of coal-fired power station electricity, at the individual level, even if a couple of 100,000 people do it, we really want the whole country to do it to make a big mitigation impact. So mitigating is trying to cut emissions. Adaptation is very different. And this is, I think, more challenging for governments to implement and needs to be supported by government, but is much more at a community or societal level. This is things like knowing and being prepared for things that's going to happen. So, for example, if you have a meteorological service or a weather service in your country, you want to advocate for them to let you know in advance if there's going to be a heat wave or a flooding event. You want that information. Yes, it needs to be supported by governments, but you need them to be able to give you the information to make sure that you can put steps in place to prevent adverse health effects as much as possible, because that heat wave is going to happen or the flooding event is going to happen. So adaptation would be things like early warning systems, improving flood management, creating spaces where people can go for like cooling centers when it's very hot, and training for people to be able to better understand what to do. You know, in a healthcare facility, when there's going to be an extreme weather event or a climate change related event of extreme weather, whether it's suddenly an onset of a severe drought, how is the clinic going to cope with so many more sachets of rehydrate or whatever they need to do? Are they bringing it in? Did they think about it in advance? They need to know. So this is trying to adapt and survive. And this links to our resilience. The resilience is really at an individual level. So we've talked through the different levels in national, community, societal, and individual. Being resilient means that we have got things in place, possibly with our neighbors, to make sure that we can protect ourselves and prevent adverse harms. This could be something like, in the event of extreme flooding, the community has got together and put together a group together with maybe emergency services to ensure that children are aware that there's flooding and they don't go near rivers that are going to break their banks. Because we want to make sure that there's less drowning during these events. We want to protect our children. So if we are to be resilient, we have to take that upon ourselves, hopefully with the support of our government, advocating for that support. But it is within our communities and within our homes that we should try and build this resilience.
Thank you for that response. In fact, it ties in with my next question, which somebody had. If we are thinking at the higher level, the health systems level, what can a country do so that it develops resilience against the effects of climate change? There's only so much that a community or a group can do. But what about the higher national health systems, especially in Africa, where we know that our systems are pretty fragile and climate change is just an additional challenge?
Yeah, absolutely. So that is a very, very interesting and difficult question to answer. I'll try, and I'm certainly not going to be answering it entirely. I think that for healthcare systems at the national level, we do need the paperwork. So the paperwork, whether it's policy or law or guidelines, we need those things in place. They give us a leg to stand on when we are trying to motivate or advocate. So we need those things in place. The challenge, of course, comes to the implementation. First of all, not everyone even knows about them when they are there. So we've got to try and raise awareness and keep pushing to say this exists. How are we going to implement? How can we resource its implementation as well as have the capacity to ensure that these things can be implemented on the ground? Then we need the resources and we need the capacity and we need government support for all of those. We also need training. So even if you have a national heat health action guideline, if all of the environmental health professionals in your country don't know about it, what's the point? So then we need to do whoever, and I believe that researchers have a role to play because we contribute towards these. Dr. Vincent spoke earlier about contributing towards these guidelines in South Africa. So then we have the responsibility to do the training in all of our provinces to raise awareness about our national heat health action guidelines. So people know in the event of a heat wave, I know what resource to go and look at. And yes, probably the first time it happens, it will be a reactionary response. But in the future, there could be some planning in advance to know what are we going to do the next time that this happens. So I do think that there are roles for national government to play, both in preparing the documents, but then giving the support that is needed at the grassroots level, whether it's province or district or local municipality, for the people who are actually working on the ground. And in many instances, our environmental health professionals are the ones trying to roll these things out, as well as disaster risk management.
So just leading on to what you've said, we've been listening to you. Excellent presentation, great ideas, and so on. What can each one of us as individuals go away with? What are we going to do with what we've learned today? Is there some possible steps that we can take as health professionals going away from today?
If I could answer that in one sentence, tell one person that didn't attend this course something that you found interesting from today's learning session, and share that information and knowledge and get somebody else excited about what they've heard, so we can really collectively make a difference for climate change and health in Africa.
Thank you. Good advice. So with that, I think we've come to the end of our first session for this course. And I'd like to thank Dr. Wright again for giving us a very informative, very clear, very responsive presentation to what the issues are in climate health. I can see the chat, they're really happy with this, and it's coming at the right time. So thank you again, once again. So at this point, we want to go to the next part where I want to invite you to evaluate the session. If you can look at your screen, you can see the post-session survey. You can scan with your phone on the QR, or you can link in the chat. So can you just take a few minutes and evaluate the course? We'll give ourselves a few minutes. Thank you so much. Thank you so much. Join the course WhatsApp group for updates and information from the course planning team. I know that some people were saying that the WhatsApp was full. So I encourage you, there's a second WhatsApp group that has been formed for the course. So do join that and do keep yourself up to date. So thank you very much. Merci beaucoup. Obrigado.